Welcome. This is the Dentist News Network. Nurses who care for patients with dementia now have another tailored approach for dental hygiene for their patients, thanks to a pilot study by a team of nurses at Penn State University. My guest is Assistant Professor Rita Jablonski and her team. They introduced an oral hygiene approach called Managing Oral Hygiene Using Threat Reduction, specially designed for dementia patients. Professor Jablonski, thanks for speaking with us today.
You're welcome. My pleasure to be here.
Let's clue in the viewers what the special issues related to oral hygiene and any other health care that dementia patients have.
Well, most of your, well, not most, all of your people with dementia are older adults, and they tend to have reduced salivary flow. Plus, if they're a nursing home resident, most nursing home residents take an average of 8 medications. A lot of medications reduce salivary flow. Saliva has antibacterial properties. Furthermore, as we age, our gums pull back a little bit, they recede, and exposes more of the tooth. So you have reduced saliva and more exposed tooth, thus making teeth very prone to the effects of bacteria, and thus cavities and decay. Plus, people with dementia, as the dementia progresses, they are unable to do a lot of their own care. Dementia has been called moving backwards in time. So the tasks you learn last, like the higher thinking types of analytical tasks, like balancing a checkbook, you lose those abilities first. The abilities you learned as a child, say dressing and brushing your teeth, you lose them later, but you still become very dependent on others for care. And the final piece is the majority of people are entering old age with their own teeth. So you have a recipe for disaster. You have people who are dentate, who are already at risk because of the aging process and reduced salivary flow, and then they are unable to do their own mouth care.
And what we know from periodontal disease is it can have some other drastic effects health-wise, like cardiovascular problems and type 2 diabetes and, I mean, everything you can possibly think of. And so the problem then comes with treating these people because, well, then the solution would be then, well, we just have to go in there and maintain their oral hygiene a couple of times or maybe once every couple of months. But the dementia patient is unusual for other reasons in that they're sort of difficult to treat, aren't they?
Yes, and when I say oral hygiene, I refer to twice daily mouth care. Mm-hmm. We really are supposed to be brushing our teeth a minimum of twice a day, and the dentist will tell you after every meal. That oral hygiene is different from dental care because I think of dental care as being things like plaque removal through scraping, the application of fluoride treatment by a dental hygienist. So oral hygiene is a necessary part of everyday health promotion. And a lot of people with dementia aren't getting it.
Okay. You talk about you have a 15-step process or ways that you can make this happen. Can you talk about that?
Sure. It's actually a set of strategies, like a toolbox, if you will. And there's all different ways to reduce the perception of threat in people with dementia. People with dementia, the parts of the brain that help them make sense of situations are compromised. So any type of interaction can be perceived as threatening. So me bending over someone to brush their teeth, I could be seen as an attacker. So some of the techniques we use are almost common sense, if you will, such as approaching someone with dementia using a smiling face, a friendly approach, approaching at or below eye level, speaking to people in a low-pitched voice, because as people age, we lose the ability to hear higher frequency tones. For example, my kids are all teenagers, and they have cell phone settings where they can hear the cell phone ring, and I can't, because I can't hear those higher tones, and I'm in my 40s. So after age 30, we start to lose these higher frequency tones. By the time we're in our mid-60s and beyond, we've lost quite a bit of that higher end. unfortunately, a lot of healthcare professionals and even lay people, when they speak to older adults, they will launch into a speech pattern that is been called elder speak or identified as elder speak. And that is a speech pattern of a sing-song cadence, high-pitched tone of voice, and the use of plural pronouns. It's the way you would talk to your dog, you know. Hi, Rover, how are you? Hey, boy, you want a bone? You know, that type of sing-songy,
Right.
a baby talk, if you will. I see so many individuals speak to older adults in that way. And a person with dementia, he or she may forget his or her name. They may forget what year it is. They may forget that they have kids, but they'll never forget that they are an adult. And elder speak is an affront on their personhood. It's an attack. So there's a really well-known researcher, I want to say by the last name of Williams, and she has done a lot of work on elder speak, and her research has shown that elder speak is usually an immediate precipitant to care-resistant behavior in people with dementia. So we teach I taught my team to avoid the use of elder speak, to use short one-step commands, to use gestures and pantomime, because dementia is an umbrella term, but there's many different types of dementia. And what we're finding now is many people have multiple pathologies. So with vascular dementia, for example, which you would see after a stroke, a lot of people with vascular dementia may have trouble understanding verbal commands or also communicating as well. So we tend to use a lot of gestures and pantomiming when you are trying to get someone to do mouth care. Another important step is to promote as much independence as possible. A lot of healthcare providers, they want to do for the patient because it's faster. I can just go in and zip, 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 brush somebody's teeth in a few minutes. But if I have the person do it him or herself, it takes longer because I have to prompt the person and guide the person. The thing is, older adults with dementia, they're okay with putting a toothbrush in their own mouth. They're not too thrilled with me shoving, you know, in their perception is I'm inserting a toothbrush or shoving a toothbrush in their mouth. So allowing a person to do as much of his or her mouth care as possible helps reduce care-resistant behavior.
You know, it's fascinating work here with the aging of the population. It seems like issues like this are going to become more and more common.
They are, and the way the healthcare system is set up, we really can't afford to keep institutionalizing people as they reach a certain point. We're all aware of the concerns about the federal deficit, about Medicare and Medicaid. So I'm hoping once I better test and refine these strategies in the nursing home population, we can translate them to people caring for older adults with dementia at home. I recently found out that the National Institutes of Health will fund my 4-year study to take this protocol, if you will, and test it against routine mouth care in 5 nursing homes in Pennsylvania.
Well, congratulations.
So we get a better idea. Oh, thank you.
That's always good
news.
news.
Thank you, and it's not easy to get federal grants in this climate.
No, that's for sure.
So we were pleased to hear about that. So I will have more data as to which strategies work the best in a larger population. Pilot studies, you always do use a smaller group of people to get a sense of what works, what doesn't work, and how well this can be translated to a bigger group.
We will provide a link to the preliminary strategies that Professor Jablonski has developed here, and we will keep you up to date on the progress of the newest study. My guest is Professor Rita Jablonski. She's an assistant nursing professor at Penn State University. Rita, it's been a great pleasure, and it's fascinating. Thank you for taking the time today.
Oh, you're welcome. Thank you.
And thank you for watching the Dentist News Network.